Okay, so I've got a couple of slides. I'll do it quite quick and try and end within allocated 5 minutes. I think Weng Mui has done half my work for me already. So I'm Jimmy. I'm a psychiatrist at the Institute of Mental Health. I also have an academic appointment with the Lee Kong Chian School of Medicine in Singapore. Okay, so I do a little bit of research, particularly in the last couple of years around digital mental health, but primarily really my interest is in how to improve care outcomes for large group of individuals. So I'll start with this. I have only 2 particular digital projects that I thought I want to share with the group. I see Robert here. So Robert is one of the brainchild of this particular project I'm talking about. It's myline.sg. So this was started about a year ago at the height of the pandemic in Singapore, I must say. So that's about April to May period, where we suffered from a lockdown equivalent, and there were a lot of mental health issues, of course, of concern, learning from other jurisdictions as well. So we came together, led by Robert, and we tried to cobble up a platform that we launched in June. Now, in this particular platform, there are 2 main components that's worth discussing or describing about. One is actually more an emotional self-help evaluation. Now, to do this, because we thought, well, some people may be feeling a bit down and out, but they may not have the words, that they do not know how to describe what they're experiencing. So we use the tool for them to do some self-assessment. And for this, I use the PHQ and G87, very commonly used population screening count instruments. And through a series of stratification, help direct them towards, based on their scores, towards resources that we put on this particular platform. Now, what is unique in this is that we do cobble together resources that are available in Singapore. So these are local resources. Anywhere right now in the world, if you go to myline.sg, you can access the website. It's just that the resources will not be tailored to your jurisdiction. And I think in this particular website or this web browser, it was a collaboration led by MOHT that Robert is in, myself at IMH, as well as parties from National Council for Social Services and Ministry of Social and Family Development. With the group of people involved, you can probably understand that we are not seeing mental health purely from a psychiatric or clinical angle, but really as a very broad social paradigm. Hence, we also have tiles in this web browser looking at things like financial support, employment support, caregiving support, as well as domestic violence, which is something that has been quite reported in the pandemic with the lockdowns. We also had a particular tile or resource for individuals who feel that they're doing well or want to find resources on how to keep themselves well. So things on keeping fit and healthy becomes one of them. This has gone on for the last 1 year. We have had more than 300,000 visits to this website since then from locally, and some of them are repeat users. And a couple of months after we kind of launched the myline.sg, we worked with a chatbot to integrate it into the stratified emotion self-assessment. Sometime this year, actually last month, we created the myline.sg at workplace. Again, testament to actually the work-related kind of mental health stresses that are a little bit more unique. So this is a work in progress. It's iterating along the way, and we wait to see in the next 1 year what are the groups that we can roll myline.sg into. The other piece of work that I want to talk about is digital phenotyping.
Actually, Jimmy, sorry, I don't know if it's your screen that is frozen, but your slides are actually not showing.
Oh.
I don't know if you're flipping through your slides, but it's still in PowerPoint mode.
Oh, I see. Okay, let me see. Thank you. I'm not sure what to do. Gosh.
Maybe unshare and then share again. I think it might be just frozen. Yeah.
It's not on full screen.
Yes, it's on now. Great.
Okay.
Can you see?
No, actually, it went back to the first page.
Oh dear. Okay.
Yeah, I think you just stop sharing your screen and then you reshare again. Yeah.
All right. Don't know whether it will happen again.
It's
loading. Did it happen again?
Loading.
Can you see my screen, Joan?
No, it's actually still on the first page. Maybe click on the second page and see if it actually goes to the next page. Ah, yeah.
Okay,
Okay,
full
now
screen.
full screen. Perfect.
All right, I'll move on.
Yes,
Sorry.
it's working. Yes,
All
great.
right, so the next piece I'm going to talk about is digital phenotyping, something of promise that we actually started work with before MyLine came about. And really, we are trying to utilize digital behaviors to see whether we can understand the digital fingerprints of individuals with mental illness and try to use that digital fingerprint to empower and enable the individual to self-help. So with this particular setup that we have, we created a series of dashboards that we can convert this data into for various users, either for the researcher, for the data analyst, or even for the clinician perspective, all right? So the clinician can do the self-monitoring and do the monitoring of the affected individual. And this was a project that we launched for individuals with schizophrenia who are recovering. So this will actually provide the case management or the care team an overview of this, the behaviors of their patients over a long period of time is continuous and momentary. Quite unlike the typical setting right now where we only see the patients when they come for consults, which can be monthly or 2 monthly. This provides really almost 24/7 kind of a view. So this is what it looks like to the researcher on the end, and you can imagine it's probably not going to be very clinician friendly. So we converted this into something more friendly for the end user, looking at key digital behaviors around sleep, sociability, as well as mobility. Mobility to individuals with psychosis has been strongly found to be associated with functioning. And functioning really is what we're looking at for patients with a mental illness. How well they are doing socially, how well are they doing physically, how well are they sleeping, how well are they socializing. And this gives us a snapshot of this individual as well as the trend of their digital behaviors over a period of time in the last week, the last 1 month. And what we're actually looking for are actually early signals or markers that can tell us that an adverse clinical event might happen, for example, a relapse or an hospitalization. So this is still work in progress. The study is ongoing. If you're keen to find out more, I did share the link with Becky, who put it on the website. So my last slide in the last minute, digital mental health to me, I thought it offers a lot of opportunities. Number one is very quick to scale, as we saw in myline.sg. We didn't launch till date, 300 over 1,000 visits very quickly. The impact potentially is to integrate across platforms. As you can see again for myline.sg, how we can pull together all various online resources onto a single platform, organize it, stratify it, and personalize the information to the individual. The ability to integrate mental and physical health, I think making it a holistic healthcare platform is definitely promising. Of course, that's an end goal that we all hope to achieve. Now, challenges I will not undermine, and think all of us are quite aware in this space. Data, all things data related to digital health is a challenge. From privacy, security, ethics, all the way down to regulations, how tight the regulations are, the kind of jurisdiction you operate in, they will affect not just the development, but even the launch of such platforms. The other issue is actually acceptability. When we started this project, a lot of us were worried about end users not accepting it. And I think we were quite surprised because a lot of the end users actually did enjoy using it. You talk to them about their symptoms, they actually look very glum. You talk to them about their Fitbit or their digital wearable and become very cheerful and very engaged. What we found to be challenging was actually healthcare providers and whether they accept such a platform. Now that is a great challenge because number one, they don't understand. This is not the traditional healthcare model of delivery that they're familiar with. Number two, we have never monitored an individual so closely 24/7. We see them only during the consults. Providing this extra additional information presents them a dilemma. What do they do now with so much information that's coming to them? So these are challenges that I think we need to think about and wrap our head around. And really out there's just so many of these digital apps, interventions, and all purporting to do a lot of good. The issue is really, are they truly effective? I think that's something that we need to evaluate them robustly. And I think that's also the emerging challenge for digital mental health. Thank you. That's my last slide.
Thank you.
Amazing. Love the work that you're doing. I guess we're self-moderating, Becky. Is this?
Yes, I'm here.
The modus operandi.
Exactly,
okay.
Self-moderation. But I'm here to help. But please go ahead, Joan. You're up next.
Sure. So I think maybe a quick introduction of myself first. So my name is Joan and I'm the founder and CEO of a company called Thoughtfull. So Thoughtfull with 2 L's. And we're a digital mental health company based here in Singapore as well. And most of the work that we do is around employers and organizations, very much focused on the preventive care for now. So I'm going to break it up a little bit. I'm going to try and see if I can share a video. I don't know how the audio will work. Can everyone see this?
Yep.
Right. Yeah.
Yep.
I don't know if the audio. Can you hear it?
Do you click share sound? If you didn't check on the box share sound, then we can't hear it. So when you share on the bottom left, it has a checkbox. You must click share sound.
Okay, 等一下.
Digitally challenged presenters today.
I know. And we're talking about digital mental health. This is very embarrassing.
No, don't feel embarrassed.
I think you've just exposed the big problem with digital mental health. It's the user interface.
But we're all laughing, right? So that's improving our well-being. So there you go.
Absolutely. And now my share button doesn't even work. Oh my dear. Okay, hang on. Share sound. Oh, perfect. Okay. I'm going to try again.
Finding it hard to focus, easily distressed, having sleep troubles? Don't worry, you're not alone. 1 in 4 people go through a mental health challenge at some point in their lives. Getting the right support so that you can be the best version of yourself doesn't have to be hard, expensive, or complicated. It can be as easy as having a thoughtful chat. Everyone has different needs, so get connected with your best fit mental health coach instantly. All our certified mental health coaches are fully vetted and trained to ensure you receive the best support. Privately text or send a voice message to your coach, who will provide you with daily bite-sized coaching asynchronously from Monday through Friday. Finding it hard to stick to your goals? We got you. Set your intentions on the app and we'll journey with you. With bite-sized lessons and tools, our users won't stop learning. It's not just self-care tips, it's science-backed. How you're feeling on a daily basis matters. Create a healthier and happier mind through our daily mood tracker and guided journal. You probably know your height and weight, but do you know where your stress, anxiety, and depression levels are at any one time? The more you know, the more you grow. With Thoughtful Chat, you can now engage with your mental health anytime, anywhere, all from the convenience of your phone. Focus, calm, healthy, invest in yourself, and have a thoughtful chat.
Okay, so I thought that would be easier to explain what I do rather than having to explain through slides. But anyway, I think as you have seen, one thing that we do is make mental health care, or rather the access to mental health care, more seamless and affordable for people. One of the ways we do that is through Thoughtful Chat. What you saw over there is what we do for the user side of things. Now, I know we have audiences from different parts of the world, so maybe just to level set as well, Singapore is probably one of the most advanced countries in Southeast Asia, but I can tell you that for the majority of Southeast Asia, it's still a very fragmented market when it comes to mental health care, simply because the healthcare systems are less seamless and also less interconnected. So really what we do, you can look at it from I guess, a macro perspective. One, on the supply side, we're trying to make things a little bit more seamless for our supply side, meaning to say, you know, our certified counselors, psychologists, who majority of the time work outside of the medical system, right? Because they're all allied health workers. So we're helping them to digitize and standardize kind of the method of care delivery when it comes to mental health on this one-stop platform. In terms of Thoughtful Chat for users, really the user experience can only be seamless when the plumbing and the infrastructure is in place. If the pipes aren't running, the water is not going to be flowing. So that's really what we're doing in the macro perspective. I won't delve too much into this because I can talk about this for a very long time, as some of you here know, but I'll just highlight a couple of things that we've been doing so far and some of the findings as well. So I think the work that we do is very much focused on preventive care for now, although we have started building into the curative aspects as well to create that whole end-to-end mental health solution solution for our organizational clients. I think in terms of targeting the preventive population, we've been doing that mostly through employers. And this is very exciting for us when we find that we've been able to provide access to 94% of people who probably would not have showed up in, the counseling room in the first place. Now, what do we mean by this? It means that 94% of our user base are people who have never engaged with their mental health before. So they've never seen a counselor before, they've never talked about it before. And this is, again, a testament to the stigma that I think Professor Wing Mui just now brought up, especially here in Asia. There is always a reticence to engage with mental health. So we're trying to destigmatize it, make it more discreet, make it more engaging and approachable. And so that's how we actually reach the market that won't show up usually in the treatment room. We are also trying to promote engaging with mental health care as more of a lifestyle choice rather than a crisis intervention or medical treatment, because I think when we normalize engagement with mental health, that's when we really get people to prevent any kind of crisis from happening in the first place. So I think what we do usually is, on top of the app, when we work with organization, we layer on non-app based kind of programs as well, and through these activation programs along with the app, we're able to drive almost 30% of utilization of mental health services. This is very different compared to the typical 1 to 3% utilization that you see in employee assistance programs in the workspace environment. So I think one of the common things that we do get, we collect feedback, quantitative or qualitative, like no other. So there's actually a lot, but just the common themes broken down here. I think one is we're able to help people feel validated and heard through our coaches. And I think also in terms of our working model, that's where we see that most people find their providers or their coaches giving very quick and actionable tools. This is very important for that working individual, right? When they have a very quick lifestyle. The reason how we achieve this is because our model is a bit different compared to the traditional kind of telemedicine. So I guess in the traditional format of telemedicine, what you'll do is it's more like a booking platform. You book a 60-minute counseling session, you have your session, and then it's done until your next session again. We've kind of broken that down specifically to target the preventive care side. So what we've done is actually taken a more coaching approach. So our counselors and psychologists essentially are on the app. And when a user wants to engage with their mental health coach, our algorithms will match them to their best fit coach. The moment they're in there, they have full access to their coach through text and audio message, and they can text anytime, anywhere, and our coaches will check in asynchronously within 24 hours. Hence, the quick and actionable advice and tools that feedback that we get. So I think it's a slightly different model, but really what we're driving towards here is more longitudinal and consistent engagement with one's mental health. I'm going to just end with 2 more things, really around kind of the science behind what we're doing. We are a young company. We've only just launched Thoughtful Chat last year in May in the midst of the pandemic. So around the same time as Mindline, I guess. So I think one thing that we're seeing is that we have found statistically significant improvements for across the board depression, anxiety, and stress. This is based on a population size of about 300 people, where we've been following on a cohort basis. So that's something that we've found, and we are trying to take this one step further, moving towards more evidence-based digital forms of preventive care. So our first clinical research has just been published, or rather, I guess, put up on clinicaltrials.gov. We are in the midst of this trial right now, and hopefully, we'll find the results in the next couple of months to come. So I guess for the next event, I'll be able to share maybe the results, whether good or bad or in between. I'll have something to share then as well. So yeah, I'll stop here. If there are any questions, feel free to jump in.
Thank you, Joan. And by all means, I'll put links up on the chat, on the conference site. So yeah, thank you very much. Okay, so what we might do is go through the presentations and then take questions at the very end. And we'll stay here until for another 15 minutes or so. So Matt, if you'd like to go next.
Okay, thank you, Becky. Hey, we have a moderator in the room. Anyway, I will cover 3 parts. I think first I will briefly talk about my relationship with mental health. I think this is not just a job for me. I think it's kind of like quite tied in personally to my life. And then I think second, I will talk about what my product, which is Acceset, what it does through a 90-second video. And lastly, I will talk about some of the experience, some of the interesting things I've seen from rolling out my pilot in Institute of Technical Education. So these are students who went through about 10 years of education and they decided to go on a more applied learning path. They are very hands-on technical people, and also running this pilot with Nanyang Technological University. So 2 very different profiles of students. I've seen some interesting things that potentially could be relevant for all of our work. So on the first part, I come from a family that is low resource, and I think as a result of Asian financial crisis plus many other factors, my mom eventually had schizophrenia. I have IMH to thank because I think when they set up this like jobs club kind of initiative, helping people find job, it helped my mom a lot to become a cleaner, to find a routine, to be able to contribute. But because of my family, you know, my dad has to bring money to the family and working long hours. My mom's kind of like in her own world, so I had to grow up very quickly. And I think when you grow up very quickly, you find that it's very hard to relate to people, your peers, and vice versa. And I think that really kind of like sparked my interest in mental health. And after working on digital solutions with Health Promotion Board, I decided that I wanted to do this. Interestingly, at that point, I think the attitude in 2015, 2016 was, oh, you know, Matt, you can't do this. It can't be done. You know, things can't be done on technology. Everybody will, there'll be a lot of risk and all these things. And community people cannot be part of the intervention because you're not knowledgeable enough. And in my mind, I trust the experts, but at the same time, I also wonder why hold on to the status quo so closely. And while I respect the professional advice, I also want to try it out. And if it cannot be done, it must be me who come to this conclusion and not just following the advice as it is. And that's what really drives me to do this work. Now I will kind of like shift, I mean, with a little bit of history, I want to shift into the product. What exactly can Acceset do that allowed the schools to open their arms and allow us to come in and work with their community to provide better support for their students? So let me share this video here. I guess just now Dr. Jimmy mentioned about some kind of digital phenotyping and, you know, like collection of data around functions. I think like you alluded to the idea of a digital biomarker. I think that's also something that we look quite closely into. We look at the emotions, we look at the functions, we look at the reasons, the motivation, the psychological unmet needs that that inspire people to open up and share about their stories. And then we kind of like track them on a letter to letter basis. Because currently the trial is kind of ongoing. I don't have the results right now to share with you, but in the process of outreach and kind of like talking to users, I found that there is a lot of stigma. I found it quite interesting. So when I went to ITE, like the applied learning students, and I say that, this is a place, this is a safe space, this is about anonymous help seeking, there's no judgment, like we just spin around that. If this is the main point, it's about help seeking, my take-up rate is like in a class of 40, maybe like 1 to 3 people say, okay, I want to have an account, I want to sign up. And I thought, okay, it wasn't working. So I went to another class. I spin the thing around and I give them a positive reason to try this out. I say, this is about personal development. Because you've never had a space where you never had the opportunity where you actually look at your emotions, right? And look at that past experience and you process it. Yeah, so this is really about being a better person. And I think I found that when we give a positive reason, it helps to remove some of the shame that comes with, associating with a brand. And I feel that all of us in our various capacities and project could use this to some of its effect. I mean, tailor it to your audience, and potentially you can see better activation and take-up rate. And then suddenly from 3, I have like, one class, 16 people. Hey, but actually they are doing the same thing, I'm just putting a different spin to it. And I found that helped a bit. Then, of course, there are also some student characteristics. The Nanyang students, their stories are very juicy. So when they break up, they have like a lot of details. And then my IT students is just, how do I move on from my ex? And then they send a letter. So I felt that was also very authentic. And it tells me that I need to do more to make it easier for them to use the service. There's a lot of room for innovation. And I would just want to close off by saying that there is a lot of potential when we design systems that can collect data in a disciplined fashion. So when I completed a project with one of the polytechnic, I can actually point things, very specific things that the teachers may not even know about their students. I say that you know that some of your students are struggling, right? But do you know what specific emotion they are struggling? And when they tell you that, for example, I'm feeling very sad, what are they actually sad about? I can tell them these things. It's not perfect, it's not robust, but I always feel that some evidence is always better than no evidence. And for some of us, where we are just starting out, I think it's always difficult to convince that there's enough value to push for a bigger project. And I always fear that at the end of the day, like any new initiatives will be kind of like not given its time to develop fully, and it gets killed off. But I know that the more data we can collect, we can get better. And that's something I feel for all kind of innovators in this space. We should continue trying, and the more we try, the more we learn, then the more collectively we can advance the knowledge of mental health, and eventually it will help the old and the young who have mental health issues. So with that, I come to the end of my presentation. I would just maybe end off on the final note and say that I'm also working on some research work together with NUS to look at evidence collection in a more robust and publication ready manner. And very happy to have a chat with all parties in the room today to explore collaboration opportunities.
Okay, thank you very much. And our last speaker, thank you for your patience. Janhavi, if you would like to do your presentation.
Thanks, Becky, and thanks everyone for waiting until this very last slide presentation today. I'm going to keep it really quick and short. So please excuse me if you really wanted to hear a little bit more, but in the interest of time, I'll just jump into it straight. So hi everyone, and good morning, good afternoon, good evening, whichever country or place you are from currently. So my name is Janhavi. I'm a Deputy Director at the Research Division of Institute of Mental Health. I work with Jimmy. And most of my research has focused on epidemiology. So I'm an epidemiologist by training, but looking into mental health as well as health services research in this arena. And a large part of what I have done has focused on this aspect of positive mental health and really looking at it from the social, cultural, and multicultural aspects available in Singapore currently. Okay, sorry. Oops. All right. Can you see the slide too? Okay, so basically we do a lot of research, and epidemiology is basically our bread and butter, and we do a number of studies, mostly in the area whichever is funded. So we do a lot of projects for the Ministry of Health, but at the same time we have our own interest, and one of the aspects that we have followed for all our research is active dissemination, through which all the results are presented to all stakeholders, including the ministry as well as the general population. So this is basically what I have been doing for last over 1 decade. So apart from the epidemiology, which forms basically a bulk of what we do, along with that, my personal interest has been to look at this construct of positive mental health. And this all started when we initiated our National Mental Health Survey, first comprehensive survey in Singapore in 2008. And that was actually looking at mental disorders. But we felt that we should also look at positive aspects of mental health. And that's where our journey started. So a bulk of our work initially went into understanding this construct and how it can be applied to the multiracial society in Singapore. Following that, we also looked at how it could be measured, how these different domains could be measured. And a lot of work has gone into really psychometric development of these constructs and its subdomains, as well as looking at how they pan out in different populations, such as married or in different genders or different ethnic groups or even in religions. Lately, it has been incorporated into a cohort study, and so we are hoping to see some temporal kind of results coming out of it. But along with that, we have also looked at lifestyle and health behaviors and their association with positive mental health. More recently, we have looked at really thinking about how should we use the information that we have on this construct and really apply it in clinical populations or for health promotion. So we are non-clinicians, most of us purely coming from research background, but we really wanted to make use of it, so you have a good tool, but what do we do with that? And that's where we are. So we worked with the Department of Psychotherapy at the Institute of Mental Health and collected a lot of qualitative information at this stage from both the therapists as well as the recipients. And we are also looking at positive mental health and how the youth in Singapore look at it. So I think this is just a snapshot of some of my challenges, and I'm going to keep it short. So now we are into this area where we really want to plan some interventions, and digital seems to be the way to go forward, really, in terms of COVID and all the social distancing that's happening, the mental health impacts. But at the same time, due to the extremely high internet penetration in Singapore, we are really looking at developing or testing or really using the information that we have in apps. So it could be developed by us, or we are happy to work with anybody who has something existent. But these are the challenges we are facing currently on really prioritizing what areas we should look at. So if you look at from a psychotherapist perspective, like an app which is really dealing with therapy perspectives or group therapy perspectives, it's very technical, and it's very technique oriented, and it needs to follow a process. But when we talk to recipients, their demands are pretty simple, just how to deal with everyday life and carry on without having a lot of impact on their mental health. And then we look at this group of youth or young people who may or may not have problems of their own, but they have their own demands, which are extremely broad. So there has to be a little bit of prioritizing going on. Thankfully, we have a number of apps, including Mindline in Singapore. So it kind of gives us an opportunity to really look at it and see what we can adopt or really apply in our population. But main perspective that we would look at it is really something that would apply to the cultural sensitivities as well as demands that we have in Singapore. And that's where we are currently, and really a novice in this area, but really looking forward to learning from all your experts and seeing how it can be helped in the long run. That's about it. Thank you.
Okay, super. Thank you. So what I'm going to do is in a moment, I'm going to bring us all back into the main room, although we're here, so apologies for that. But while I'm doing that, it's about 60 seconds warning. And I just wondered if anyone had any questions that they would like to ask. And I see Adelina. Yes, please go ahead.
Thank you all so much for your wonderful sharings, and I'm really excited to see all this development. I'm also from Singapore. I'm currently based in London. I'm an applied theatre practitioner who uses theatre, and I've been working with young people from low-income families for a very long time. So one question that I have is, for those who are developing the workplace apps, I think these are absolutely really timely and important. But in light of the COVID-induced unemployment, what about those who are unemployed or even low-income workers? Nat, obviously, you've seen the difference between working with, students from ITE and students from NTU. There's also an income gap between these two students, as you know. I mean, we've been talking about inequality for a very long time in Singapore now. Don't the low-income workers and those who are unemployed need digital innovations in mental health even more post-pandemic, if we can even talk about post-pandemic?
I will just maybe speak about one point. I don't have a full understanding of this subject. Obviously, poverty is a very complex subject, but one of my client works with such a population, and one thing I have seen in my observation is sometimes they have a lot of fear, and sometimes that fear is inherited from their circumstances, poverty being one of the reasons. And I think with less resource, sometimes they have to do more. One thing I do know is sometimes circumstances can get in the way. In a sense, it distracts you from developing the skills that you need in order to own the problem and overcome the problem. And I think that the one particular role that innovations could do is to make us better people. So it requires researchers, it requires product owners to look at, okay, don't just track the number of logins, don't just track how long people spend on your thing, but also think about what is the user learning from interacting on the platform. Are there some takeaways? I think there is a responsibility we have to think about as service provider, but also we will need kind of guidance, like different expertise coming together, and a conference like this is very helpful because it brings different people doing different things to exchange notes. I can learn something from the expert, like in this field and in another field, and we can think about how we can take ideas to make our own initiative better.